The usual thing that I look at every morning is the New York Times tracker, and you can see Alabama's epi curve is declining as about as rapidly as it increased, up to 44% fully vaccinated. We're seeing declines in cases, hospitalizations, and deaths. Still doing over 10,000 tests a day, but that's also declining. When I look at places I track, including counties in Alabama and states surrounding us, it's really going down remarkably everywhere, pretty significantly. CDC changed their metrics for categorizing case levels. Their metric is to use cases per 100,000 over the previous 7-day period. So a 7-day total per 100,000, whereas the New York Times data tracker, the metric continues to be cases per day. You just have to do the math, multiply by 7 to get here. But this is from CDC's data tracker. And you can see that, that there are a number of counties, particularly the counties that were hit hardest earlier on in this current surge are now at least not in the highest category. They're substantial level. And that metric is from 50 to 99 per 100,000 per week. The high is above 100 per 100,000 per week. I think where we're really looking to feel more comfortable about making any additional decisions regarding mitigation measures would need to be, I think, in at least the moderate level, which is the 25, I think it's 25 to 49 per 100,000 per week. The yellow, so you don't see any yellow in this map. When we look at campus cases, this is from earlier in the week, reporting last week's cases, 12 cases among UAB students, 8 cases among academic, non-clinical faculty and staff, and 22 among clinical employees, and the lowest in all categories since mid-July. And of the on-campus isolation spaces, 0 of 75 rooms occupied.
The cases, just like Paul mentioned, are declining. They're declining across all districts, which is the big important thing that we think about. To put it in perspective, if you want to look at the way the epidemic curve has looked for this surge, which is the Delta surge, over Alpha and over the initial surge, which actually, although it looks inconsequential, was really created the bulk of hospitalizations and deaths last year. It's just we weren't as aggressive at getting cases. You can just get a feel for the height of the peak, the width of the peak. Ignore these. These are case reporting errors. But you just get a feel for what this peak looked like versus what all others look like. The gray line is Mobile, and that was the one that was, really of concern, that if every county in the state followed Mobile, we would be in a lot of trouble. But it turned out that didn't happen. Most counties had a much lower peak in terms of cases and have now started to decline. The hospitalizations, this assumes that hospitalizations will decline at the same rate they've always declined from the other 2 surges. The dotted line is the estimated, and the solid line is the actual. If we continue to decline, somewhere around Halloween, we should be under that 500 mark, which would really hopefully give the hospitals some breathing room. 1,000 was always the target that, they would stop canceling elective procedures and have to modify changes to operation. But, in speaking to Sarah, this time, I think this particular surge has been much harder on folks than other surges. It was unexpected. It was intense. So there's a lot of getting back into it. It's going to take some time. And I really think that means we really have to get it under 500 hospitalizations to have the breathing room that everyone needs. In terms of where we are, deaths are decreasing, cases are decreasing statewide. This was the Tuesday update for the Incident Command Center, and all of these numbers are still continue to be even further down. Again, with the Delta wave, I think one of the interesting things with this wave that we're going to have to figure out going forward is what it means to have so many children that were infected this time around. This graph shows you by age group, the number of cases, and yellow are the 0 to 12s or 0 to 17s. And you can see that throughout the pandemic, 0 to 17 was almost always the lowest group. But during the Delta wave, it wasn't. It was a really high group, and it was higher than most of the other groups. So this is the one thing that I think we'll continue to watch to see, what's the impact long term? Are there any consequences to having so many people, so many young people that were infected with COVID? And these are just the ones that we know. The only other thing I'm trying to remember, I had one more that I was going to show that we discussed last week. It was not the hospitalizations. Oh, it was the CDC metric that Paul brought up, that high transmission of 100 per 100K. We're now at substantial transmission for almost all other counties. The ADPH is actually doing a really nice job. If you're interested in seeing how we're matching metrics, you can look at their landing page for data and surveillance and see we have a few counties that actually have met the metric so that people that are vaccinated would not have to wear a mask. So, the reality is this is Alabama, and I don't think we'll follow CDC exactly. We haven't done it yet. So I think we kind of go our own way, but I do think we're going to be satisfied with substantial for seeing changes to behaviors and other things.